Story highlights 5 additional deaths were reported by the FDA Monday in 4 reports. Death was preceded by a hole in the stomach wall. CNN. An additional 5 patients have died in association with intragastric balloons for the treatment of obesity, bringing the total number of deaths to 12 worldwide since 2016, the U.S. Food and Drug Administration said in an alert Monday. The intragastric balloon systems are weight loss systems that function by taking up space in a patient's stomach, according to the FDA. In a minimally invasive endoscopic procedure, the balloons are placed into the patient's stomach through the mouth. 4 of the 5 new cases are related to the Orbera intragastric balloon system made by Apollo Endosurgery Incorporated. Once in place, the balloon is filled with saline solution, and 1 to the Reshape integrated dual balloon system made by Reshape Life Sciences. 5 deaths reported while using weight loss balloon treatment, FDA says. In 4 of the cases, including the one for the Reshape device, death was preceded by a gastric perforation or hole in the stomach wall that occurred within 3.5 weeks of surgical placement of the balloon, according to the FDA. The 5th death is still being investigated by Apollo Endosurgery. The FDA has approved new labeling for these 2 devices in order to adequately inform doctors and patients about the adverse events, spokeswoman Deborah Cott said. We have been working with the companies that manufacture these liquid-filled intragastric balloons to better understand the complications associated with these devices. Read more. The FDA issued alerts about the devices in February 2017 and August 2017. She added that the FDA believes that these devices remain an appropriate treatment option for some patients with obesity, notifying healthcare providers of adverse events and deaths associated with them, Cott said. Weight loss balloon helps shed twice the weight, study says. Apollo Endosurgery said that as of March 31st, the global rate of spontaneous hyperinflation of its devices after operations was 0.07% and the gastric perforation rate was 0.01%. Separately, the company reported the U.S. mortality rate in Orbera patients to be 0.036% or fewer than 4 deaths per 10,000 patients. The rates of esophageal perforation, pancreatitis, and mortality were each less than 0.01%. Today's U.S. labeling updates will even better inform physicians and patients alike so that patient care and outcomes with Orbera continue to be excellent and ever-improving, CEO Todd Newton said. In a statement, Reshape Life Sciences said that it has received just 3 reports of deaths since the commercial launch of its Reshape balloon product in August 2015. These 3 deaths occurred out of more than 5,000 balloons implanted around the world, including those in our clinical trial, 265, and those sold commercially, the statement says. The occurrence rate of death, expressed as a percentage of all the Reshape balloons implanted through April 30th, is 0.06%. While these reports are alarming, they have to be kept in proportion with the total number of balloons placed, said Dr. Mitchell Roslin, chief of obesity surgery at Lenox Hill Hospital in New York. As with any foreign body placed in the gastrointestinal tract, balloons at risk. Still, he thinks the risk is not large. Last year, the American Society for Metabolic and Bariatric Surgery endorsed the procedure as safe and effective, said Drive. Eric DeMaria, president-elect of the society and a bariatric surgeon at St. Mary's Medical Center in Richmond, Virginia. Clearly this is tragic and we want to know more about the circumstances of these deaths, but overall we believe that the data on the procedure does suggest that it is safe and effective for the vast majority of patients, said DeMaria. The variety of available weight loss surgeries, including gastric band surgery, gastric sleeve surgery, and gastric bypass surgery, limit the amount of food taken in by a patient, with some options also affecting how patients digest food and absorb nutrients. All the types of surgical obesity treatments have risks and complications, including infections, hernias, and blood clots, according to the U.S. National Library of Medicine. Follow CNN Health on Facebook and Twitter. See the latest news and share your comments with CNN Health on Facebook and Twitter. We have been carefully tracking adverse events, including a total of 12 deaths over the past 2 years that have been reported in patients with 2 balloon devices used to treat obesity, Dr. William Meisel, director of the Office of Device Evaluation in the FDA's Center for Devices and Radiological Health, said in a statement. The FDA continues to work with the companies that manufacture these liquid-filled intragastric balloons to better understand the complications associated with these devices. Patients should discuss obesity treatment options with their doctors, he added.